What works for you works for us. We're offering on-site services by appointment only, Tuesdays, Wednesdays, and Thursdays from 10 a.m. to 3 p.m. at both our Starr County and Tuscarawas County offices. Stay connected to our services virtually through telephone and email, Monday through Friday, 9 to 4:30. Follow us on Facebook, Instagram, Twitter, LinkedIn, and YouTube. Remember, Ohio Means Job Centers gives you the tools you need to get the job you want and the employees you need.
Thank you and your team for being constant companions and friends.
You have gotten me through many years.
News Talk 1480 WHBC.
And welcome back to 1480 WHBC. It is our annual health week, and you can obviously tune in and listen on the radio or online or on your phone, any way you want to do that. But also, we should let you know that we're broadcasting this on our Facebook page as well, video streaming it at 1480 WHBC. Just go and like our Facebook page, or you can watch it on our YouTube channel. Just search 1480 WHBC on YouTube and you'll find us. And you can watch all of our Health Week episodes back there, and that'll be a lot of great information that you'll find. So this hour, we're going to talk about MHAR, Starr County Mental Health and Addiction Recovery. And a lot of things in our community surround this and recovery and wellness for folks. And that's why it's so important that we talk about it today. And first up, we're going to talk to Dr. Mader. Dr. Mader, Chief Integration Officer with MHAR and integration of physical and mental health. That's very important. And first of all, welcome to you. Thanks for coming on today.
Thanks, Pam, for the invite.
Yeah.
Before we get started, I just want to thank Altman Health System for sharing this hour with us at MHAR to discuss such an important piece of healthcare. Healthcare obviously should encompass both physical and mental health. So I want to thank them for this time.
Yeah, and you know, when you talk about that I think that's the key to it here is the physical and mental health. Explain why that's important, why the integration is important.
So the integration is very important because the mind and the body are not separate entities. They're really one entity, and when one is affected, the other is affected. And so they're on this continuous loop. So what we're looking at is integrated care, which is a form of healthcare that results from a team of primary care and behavioral health clinicians and other staff working together with patients and their families using a systematic and cost-effective approach to provide patient-centered care. When we look at what's happening in our world right now, pre-pandemic and post-pandemic, let's talk a little bit about statistics. So pre-pandemic, we had about 15 million youth and over 51 million adults experiencing behavioral health challenges. Our behavioral health workforce, unfortunately, can't keep pace. Pre-pandemic, we had approximately 8,300 child and adolescent psychiatrists in the nation, approximately 31,000 adult psychiatrists, and approximately 500,000 behavioral health clinicians. With the shortage, we are seeing that the average delay between symptom onset and treatment can be as long as 11 years. And the pandemic really has not helped us. It has really increased our rates of folks that are experiencing challenges to 3 to 4 times pre-pandemic. So we're looking at integration to address this need. And this approach is really using comprehensive and holistic care that we are addressing the whole person, including their physical health, their mental health, their emotional health, also taking into account social factors in consideration. And we want to focus, just like you said, on a person's wellness and not just their illness or condition.
And we hear the term social determinants of health a lot. I've heard that a lot recently and never really thought about it before or heard about it before. Explain what that is and why it's important that you focus on that.
Okay. So the World Health Organization defines social determinants of health as the conditions in which people grow, live, work, age, and the effect that those have on a wide range of health and quality of life risks and outcomes. But one thing we have to remember is that social determinants of health as a term prioritizes broad community-wide focus on the underlying social and economic conditions in which people live, rather than the immediate health-related social needs of one individual.
So why do you think this will be important for a person? I mean, how will it be impactful to the community?
Okay. So in healthcare, whether it's physical health, behavioral health, we're beginning to address individual needs of people through patient-centered assistance. But while these targeted small-scale interventions provide invaluable assistance to our individuals, we also need to focus on the community as a whole, because those community factors are really perpetuating poor health for all of us, not just each of us individually. And so individual fixes are great, but they don't provide long-term solutions. And the only way to have long-term solutions is really working together with collaborative partners to make systemic changes and policy action.
So what do you think a person would see in their everyday life? Like, what changes or effects would it have in their everyday life, do you think?
Okay, well, so with integration with their everyday life, right now we're aware that sometimes there is stigma if people admit that they are having some behavioral health challenges. So we would eliminate the stigma, because when you have integration, we are looking at putting behavioral health services in the context of a primary care office. And so that would eliminate stigma. We're trying to create one-stop shop. And then also we're really looking at it from a holistic lens. And so people will be noticing that a team of people are going to be looking at them through holistic lenses to really affect their health outcomes.
And that's something that probably hasn't been done before. I mean, maybe over years it has been, but it was like you said, with a stigma, you were put into a place, you were dealt with and moved on or placed somewhere. And then that was it. This is something that really probably is very impactful.
It is impactful. And again, it's not just the individual changes that we need to work through. We really need to work at that top level, which is the community as a whole in all of the domains of the social determinants of health.
Dr. Anju Mader, we appreciate you coming on, Chief Integration Officer with MHAR. A lot of good information. We're going to continue to share some more throughout the hour. We'll take a commercial break and we will be back with Health Week and Stark County Mental Health and Addiction Recovery.
Thank you.
Thank you and your team for being constant companions and friends.
You have gotten me through many, many years.
News Talk 1480 WHBC.
The radio's all yours.
1480.
It matters and it makes a difference, and we just want to say thank you.
All in one place at WHBC.com.
When struggles seem too tough, when sickness takes a hold, when cancer picks a fight, when baby's on its way, when life throws you a curveball, we've got you. With nearly 130 years in your backyard, Altman knows you and knows your community better than anyone. We're your neighbors, your friends, your family, and we want you to be the healthiest you can be. Altman, we are ready. We've got you.
Liberty Mutual Insurance Company presents and Doug.
Check it out, Limu, a roadside carnival.
Step right up, folks. Test your strength. Come see the fire-breathing baby.
Let's fan out and tell people that Liberty Mutual customizes your car insurance so you only pay for what you need.
Look! An emu wearing sunglasses!
Limu, you're famous. Only pay for what you need.
Liberty, 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 liberty.
Hello, this is Mark Coombs. Want to strike out your pain? Then Green Compassion Network can help you. See if you qualify for medical cannabis by visiting gcnhope.com or stop by their new location at 1201 South Main Street in North Canton, where you can purchase ProLine clinic-only CBD even without a medical card. Call 833-GCN-HOPE or visit gcnhope.com.
Get 5-star tools for your 5-star dad with battery power made by Steel. From mowers and blowers to trimmers and more, with the AK Homeowner Series starting at $199.99, Dad can get the work done quickly and make more time for what really matters. Shop online at steelusa.com/gift guide. Pick up at over 10,000 local Steel dealers. All prices MSRP, includes battery and charger, are available at participating dealers. Dad doesn't quit until the job is done. So get him gas-powered tools from Steel that can keep up with him. From chainsaws and trimmers to blowers and more, Steel has the tools Dad needs. With legendary Steel gas-powered equipment starting at $139.99. Shop online at steelusa.com/gift guide. Pick up at over 10,000 local Steel dealers. All prices MSRP, available at participating dealers.
There's never any FOMO with the iHeartRadio app. You won't ever have to miss out on your favorite shows and contests with this radio station again. Radio 24/7, 365. We're here when you want us. Stay connected and listen anywhere when you download the free iHeartRadio app.
Thank you and your team for being constant companions and friends.
You have gotten me through many, many years.
News Talk 1480 WHBC.
And welcome back to Health Week on 1480 WHBC. We are talking with the folks from Stark County Mental Health and Addiction Recovery, MHAR. And right now for this segment, we are going to talk to Michelle Allison-Smith, who is the Chief Officer, Coleman Crisis. And this is another collaboration, and we want to find out more about what they do. Good morning, Michelle. How are you?
I'm good. Good morning. Thank you for having me.
So tell me a little bit about your job and Coleman and how you interact with MHAR.
Yeah. So Coleman Professional Services is a behavioral health organization that's been in Stark County for, I think, almost 15 or more years, primarily serving people in an outpatient setting. So scheduled appointments with counselors, psychiatrists, nurses, etc. And then in 2018, Coleman took over crisis services in Stark County. So that's what I oversee is our crisis services in Stark County. We are located at 2421 13th Street, and I always say it's next to the old Stables restaurant for those of us that remember that. Yeah. But we primarily have 4 programs here. We have our crisis support program, our mobile adult, mobile youth, and our crisis stabilization unit. And basically, we provide 24/7 services to individuals in Stark County that are experiencing a behavioral health crisis. So that could be increased anxiety, depression, suicidal ideation, maybe an altercation with family, argument, that sort of thing. And in our crisis support services, we operate phone lines. So Stark County has a Stark County crisis line. We also have a Stark County opiate hotline, as well as the National Suicide Prevention Lifeline and the Ohio Cares line. So my staff are the ones answering those calls, and we get about 5,000 calls a month through those different hotlines. And one of the things that is really important about those, we provide that support to people who are calling in crisis, but we're often the first step to someone trying to access services. So maybe someone who like Dr. Mader called, that has that stigma attached to behavioral health. They may not feel comfortable going in somewhere or talking to their doctor, but they do feel comfortable calling in. So we often get a lot of people that are, taking that first step of getting help for their behavioral health symptoms. So that's our crisis support services. And then our 2 mobile teams are actually counselors and staff that will go anywhere in the community to someone who's having a crisis. We've gone to homes, apartments, we've gone to businesses. We've actually seen people on the side of the street, if they're in crisis and they need help, our counselors will respond to them. And we're actually and that on the adult side, we're seeing about 250 people a month that our counselors are working with and trying to get them the help that they need. And again, we're seeing them when they're in that crisis situation, but part of our job is to provide resources to them to get that help that they need, so they're not continuing to be in a crisis situation.
So this is a quick react thing for you guys and quick help for folks who need it. And I would imagine that during the pandemic how was that affected? How did COVID affect your services?
Well, it was really interesting because one of the other ways we see people is if they go to our emergency department. And so if somebody goes into the emergency department with anxiety or depression, they'll call our counselors. And what we saw with COVID is people didn't want to go to the emergency department. So we saw more people calling us and saying, come to my home and help me. Or we had more people walking into our offices. So that was a huge shift. Initially, of course, our numbers kind of dropped, but we also then saw our phone calls increase. So the people weren't walking in for help or wanting people to come to their homes, but they were increasing the call volume. So it was definitely interesting to kind of navigate our way through a pandemic.
Do people feel safe doing it now? I mean, are you finding that everybody is feeling more comfortable?
Yes, I do. So we've definitely seen an increase in people walking into our office. Like I said, we offer PPE such as masks. We took temperatures, things like that. We had our waiting room kind of set up so they felt, safer at a socially distanced. But we have definitely seen things picking up. And I think that once people made that initial contact with us, they realized that it was safe and we were taking precautions. Now, on our crisis stabilization unit, that's where somebody can stay with us. So it's for someone who's in crisis that doesn't necessarily need to go to a hospital for inpatient treatment, but really isn't safe to be at home or doesn't feel comfortable being at home. They can stay on our unit for up to 14 days. We saw a drastic decline in people coming to that. And again, I think people were nervous about going somewhere else other than their home to stay and eat and socialize. So we did see a reduction in our bed days.
Probably at the same time, you had more people who were suffering because of isolation or, problems with being at home when they weren't used to being stuck at home. Did you see any increase in that kind of thing?
Yes, so we definitely saw an increase in our calls. And then the state of Ohio started what they call an Ohio Cares line. And it is a hotline for people, just like you described, that are, at home. They're anxious about COVID. They're worried about their family members. And this is a statewide phone number that they can call to get support. And we are one of those providers. And we definitely saw an increase. Anytime that you saw the state numbers increasing, our call volume increased.
Wow. So if someone wanted to get in touch now, how would they go about doing that?
So our Stark County Crisis Hotline is 330-452-6000. So that is the main number that we utilize in Stark County for anybody who has in a crisis situation. We also have the Stark County Opiate Hotline. So anyone who has family or friends or themselves that are struggling with addiction issues can call that hotline and we will answer it, provide resources and guidance. And that number is 330-454-HELP or 330-454-4357.
All right. Well, we know that there's a lot of resources that you provide along with the Stark MHAR, and we're going to continue to talk about that. I appreciate you coming on, Michelle. Thank you so much.
Thank you.
And Health Week will continue after our break for the news here. We'll talk more about Detox, this at CommQuest Services. That's coming up after the news on Health Week as it continues right here on 1480 WHBC.
Thank you and your team for being constant companions and friends.
You have gotten me through many, many years.
News Talk 1480 WHBC.
It's Kenny and JT.
Coming up today at 3 on the Kenny and JT Show, day 2 of Browns mini camp. We'll hear from the head coach, Kevin Stefanski. Tim Street from the OHSAA will join us. We're hoping he's going to be talking about the state championships coming back to Canton for football season. We'll sprinkle the infield. We'll take your calls and so much more. Join us today at 3.
It's the Kenny and JT Show, powered by Paramount Elite ICS. Weekdays between 3 and 7 on WHBC.
Shop the Wacom Auto Mile and save the Wacom way.
Ad paid for by MPM, non-attorney spokesperson. Attention. This is an important message for anyone diagnosed with Parkinson's disease after being exposed to paraquat or other similar herbicides. Paraquat is a chemical commonly used by farmers and those that work with or apply herbicides. Residences near agricultural sites are also at risk for exposure. Scientific research showed that exposure to paraquat close to a residence increased Parkinson's disease risk by 75%. Numerous additional studies confirmed the link between paraquat and increased risk for Parkinson's. In fact, paraquat has been banned or limited for use in many other countries around the world. If you or a loved one was diagnosed with Parkinson's after being exposed to paraquat or other herbicides and suffered side effects, you may be entitled to significant cash compensation. Call us today at 800-217-0545. Our experienced attorneys are ready to fight for you, and you'll pay nothing unless there's a recovery in your favor. Call 800-217-0545. Again, that's 800-217-0545.
For the ones standing guard. For the eagle-eyed. For the knights in shining armor. And for all those who support them. We are Grainger, your experienced safety partner, offering supplies and solutions for every industry, committed to helping keep your facilities safe and your people safer. Call, click Grainger.com/safety, or just stop by. Grainger, for the ones who get it done.
This is a declaration of deliciousness. Garlic butter is taking over at Church's, starring Church's $5 shrimp and tenders platter. 4 garlic butter shrimp, 2 tenders, fries, slaw, and a biscuit. Church's, bringing the down-home flavor. Offer valid at participating locations.
Attention Massillon and Mount Eaton. ARE Truck Cap Manufacturing is seeking second shift production operators to be a part of their team. They offer weekly pay of $16 to $18.50 per hour, full benefits, and paid holidays. Visit 4are.com/careers and apply today.
Don't miss Dan and Shay headlining the Highway 77 Music Festival, plus Dustin Lynch and many more Sunday, September 12th at Tom Benson Hall of Fame Stadium in Canton. Get your tickets now at halloffamevillage.com.
We all want the same things: to find love, to watch our kids grow up, to stay healthy. That includes us at Cleveland Clinic Mercy Hospital. That's why we're open, taking appointments, and keeping you safe. So whether it's an annual exam or a new concern, we're here for you, for everything you need, for every care in the world. Cleveland Clinic Mercy Hospital. Don't delay. Visit cantonmercy.org.
If you're thinking of buying a water softener, make Verndale's Water Center your first stop, and a free reverse osmosis drinking water system is included. Take advantage of 0% financing for 1 year. For clean, clear, great tasting water, call Verndale's Water Center today.
Verndale's Water Center.
WHBC AM Kent, reliable as ever on News Talk 1480 WHBC.
WHBC News now 70 degrees, getting behind the higher teen driver fatality numbers during the 100 deadliest days between Memorial Day and Labor Day. AAA says there's a lot more unstructured driving by teens, the youngest drivers encountering new traffic situations they have never seen and perhaps taking the incorrect responding action.
During the school year, teens are doing more structured driving, to and from class, to and from practice, to and from work. During the summer, certainly going to and from work for many teens, but also there's more of those unstructured trips.
AAA's Kimberly Schwinn says 23 Ohio teens on average are killed during the 100 deadliest days each year. The brother of Olympic gymnast Simone Biles no longer faces murder charges in Cleveland. A Cuyahoga County judge dismissed the charges against Tevin Biles Thomas, agreeing with defense attorneys there was insufficient evidence to proceed with trial. Biles Thomas, accused of shooting 3 men on New Year's Eve 2018. The mother of a victim went screaming toward the defense table until security stepped in yesterday. Well, they are behind closed doors.
President Biden now meeting with Russian leader Vladimir Putin.
I wish you both presidents a fruitful dialogue in the interest of your two countries and the world.
Swiss President Guy Parmelin just before the talks got underway in Geneva.
Fox's Dave Anthony. Also beforehand, Putin thanking President Biden for the opportunity, saying much needs to be discussed. The president saying it is good to meet face to face. The Columbus-based owner of a number of shopping centers in the state, including New Philadelphia's Newtown Mall, filing for bankruptcy protection. Washington Prime Group has filed to restructure its debt, saying it already has agreements with creditors to reduce some of its obligation. They've also gotten hold of funding to continue operations through the bankruptcy process. Your next news at 12 noon, and when it breaks, Jim Michaels, WHBC News.
Your severe weather station, News Talk 1480 WHBC.
Here's your AccuWeather forecast. Sunny skies continuing for the rest of the day. High this afternoon, 75. Then mainly clear and cool this evening. Low tonight, 49. We'll have plenty of sunshine tomorrow. High on Thursday, 82. Then Friday, we'll have a little sunshine, then turning cloudy with severe thunderstorms by the afternoon, which can bring flash flooding, large hail, and damaging winds. I'm Holly Holdren for News Talk 1480 WHBC.
Hey, Father's Day is coming up, and why not win some cash for Dad? No need to give him the same old for Father's Day. Get registered at WHBC.com, and you could win $1,000 for your father. Brought to you by Bears Lawn and Garden in North Canton at the corner of Portage and Wales.
Hey, everybody. Jay Farner here, CEO of Rocket Mortgage and Rocket Companies. Last year, we saw historically low mortgage interest rates. In fact, over 1 million homeowners took advantage of refinancing or buying a new home with Rocket Mortgage. What you may not know is that interest rates are already starting to increase again, and it's likely that trend is only going to continue. Our team of experts is standing by to help you save before rates go up. With an official mortgage review from Rocket Mortgage, you'll see just how much money you could save by making a move right now. Don't look back over these next few weeks and wish that you had taken action. You could save hundreds on your mortgage payments or pay off your home loan earlier than planned. You could even take cash out of your home to pay off high-interest debt, complete home repairs, or bulk up on an emergency fund. When you want to secure a low rate, Rocket can. Call 833-8ROCKET or visit rocketmortgage.com.
Rocket. Call for cost information and conditions. Equal housing lender licensed in all 50 states and MLSConsumerAccess.org number 3030.
This time of year, Mother Nature can't make up her mind about what she's going to do. And that's not a good thing when you're trying to keep your car clean. Hi, I'm Pam Cook. If you're like me, you want to make sure it's taken care of all the time. I have a solution for you. Go to Froggy's Car Wash and get the unlimited plan. You pay one low price a month, and you can get your car washed as many times as you want. It starts as low as $20 a month. They have 2 locations, one on Lincoln Way in Perry Township. The other one is on Everhard Road in Belden Village. You're not going to find a car wash that gets your car any cleaner than Froggy's. And they use great soap that's non-corrosive. They have high-powered blowers that make sure your car is dry and spot-free. And oh yeah, they have free vacuums when you're done. It's fantastic. Take a look at their website. See what they have to offer. Sign up for that unlimited plan. It's froggieswash.com.
My name is Kate Courtley, and this is my new show, Can You Survive This Podcast? I'll be drawing on my years as a former Navy SEAL platoon commander, sniper, and CIA contractor. The show is designed to teach you techniques that will increase your chances of survival if you happen to find yourself or your family in any life-threatening disaster scenario imaginable. Subscribe and listen for free on Apple Podcasts. Can you survive this podcast?
1480 WHBC has always been there for you.
Thank you for being a voice of calm and correct information in a world of chaos and misinformation.
News Talk 1480 WHBC.
And welcome back to Health Week on 1480 WHBC. I'm Pam Cook, and we're talking with the folks from Stark County Mental Health and Addiction Recovery, StarkMHAR. And, you know, one of the parts of recovery, of course, is detox. And that's something that we're going to share with you a little bit more information. We have with us right now Wendy Hunter, who is director of the Detox Unit with CommQuest Services. Good morning, Wendy.
Good morning. How are you, Pam?
I'm good. How are you?
Not too bad. It's a nice sunny day. Thanks for having us today.
Yes, absolutely. So explain a little bit about the Detox Unit with CommQuest.
Sure. The Detox Unit, we are a 20-bed unit in Altman Hospital on the 6th floor. So we also want to thank Altman Hospital for allowing us to do this today as well. Detox is for those who need medical management as they withdraw off of drugs such as alcohol, benzos. When you think about benzos, think about Ativan, think about Xanax, Those can be very dangerous for people who are abusing them to come off of. So medical withdrawal is highly recommended, almost required in most cases, as well as your opiates and heroin and fentanyl. I think a lot of people understand that fentanyl is causing many to overdose and die in our county, especially this past year. So the detox unit is here. We have 20 beds. We are a co-ed facility. We put 2 in a room. Very easy access. I can't stress how easy it is to access us. You come to Altman Hospital right here in Canton, Ohio. Walk into the emergency department, let the registration know your first name, last name. They'll have you have a seat in the waiting area. They're going to call the unit, and someone from my team will come down, talk to you briefly, ask you a few questions, and we're going to bring you on up to the 6th floor and start the admission process.
And how did COVID affect you guys? I mean, we asked that question of everyone because we know it had an effect on everyone.
Yeah, unfortunately, COVID hit us pretty hard. Our numbers are showing that as the COVID numbers in our county increased, our numbers decreased. We took safety precautions as well. We have 20 beds, so there's 2 in a room. We went to a 10-bed unit at that point to help decrease any possible exposure. Everybody had their own room, so we stayed at 10. And we mostly stayed at 10 during the times where the state of Ohio, and especially Stark County, our numbers were high. So think last spring when it first hit, between that March and late May, we stayed at 10. We opened our numbers back up to 20 beds throughout the summer. And again, numbers were decreasing and our numbers increased. So we had more people on the unit, more bed availability. And then in October, November, December, when our numbers obviously in Stark County and Ohio were pretty high with COVID, we went back to the restriction of 10 beds. And fortunately and unfortunately, we were not turning people away. But then in February of this year, we went ahead and opened back up to 20. But we, of course, take all the precautions. We are in a healthcare setting. We are healthcare providers. We wear the proper mask, we social distance, we follow everything that the hospital follows. So although some of those restrictions outside of the healthcare setting have been lifted, we're still following them. So of course we still have COVID questions that we ask of people before we bring them up to the unit. And again, we're always in masks and wash hands, good social distancing, everything to take every precaution, but we do run at 20. And the good news is our numbers are increasing, and they've been steadily increasing, which is good. People need help. And, you know, COVID, again, impacted the community of those who are using substances just as hard as it hit anybody else. So, again, like I was saying, we saw an increase, unfortunately, this year, more overdoses than we've seen in many, many years. You know, meetings, our 12-step meetings stopped happening in person. People were isolated. All those things are a perfect storm for alcohol and other drugs to be used more and more often, and almost to the point of it being deadly for many.
And how do you think that now that your offices are in the hospital, is that something people are okay with? Are they more apprehensive? How has that worked out for you?
I think during COVID, it probably made people a little apprehensive because they didn't want to come into emergency department. And, you know, the message was, if you're sick, stay home, you know, unless you're to the point of needing emergency services. So I think they were scared to come into a hospital, scared to leave their homes, not sure what they could get for help. We tried to educate the best we could during those times, but we understood what was happening. But now I'm hoping that, kind of going back to what Dr. Mader was saying, you're walking into a hospital and there's so much stigma around substance use and people needing help for use of drugs and alcohol, that you're walking into a hospital. You're walking into a place that helps people with not just one thing. They help with many, many things. So we work with the hospital also. You know, sometimes people come in, they need emergency services first, or something else that might be related to their alcohol or drug use, and we can go down and meet with them and talk with them and hopefully bring them to the unit. Same thing for those who are admitted. So I think it's hopefully getting the message out there that we're here and we're here to help. And if you need medical attention, the hospital's right here too. And we can help coordinate those services.
So if somebody's, got a loved one, they think it's time, or somebody listening maybe thinks that's what they need to do, what do they bring with them? What's the process for them?
You can walk right in, and if you're planning to come in, we always say bring enough clothes, such as you're going to wear scrubs while you're on the unit, so bring underclothes for at least 5 to 7 days. Bring some socks, maybe some comfortable slippers. If you have medication that you're taking, prescription meds, we highly recommend you bring those. We will work with you on those if you do not. But our doctor really, stresses that's important, so he can see what you're taking, what you haven't been taking. Maybe bring a list of medication with you. But basically, it's bring yourself, bring some personal care items. If not, we have everything that you need. We will take care of everything. From if you don't have a jacket, some people walk in, they don't have a coat, and they get cold. We'll make sure you're warm. But again, it's about come in. If you have an ID, bring an ID. If not, we'll work with you to get it. But the most important thing is just show up.
And is it a 24-hour thing?
We are staffed 24/7. Through this past year, our admission hours have changed. We admit between 8 a.m. and 10 p.m. So you get here between those hours, and we'll start the admission process.
All right, Wendy Hunter, thank you so much. That's a lot of good information for folks, and obviously can get more information at CommQuest Services and the website there. What is the website for CommQuest?
We are at CommQuest.org, and the phone number for Detox is 330-830-3393. Again, it's 330-830-3393. And our website is CommQuest.org.
All right. Very good. Thank you so much, Wendy. Appreciate it.
Thanks, Pam.
All right. We are going to take a commercial break here. And when we come back, we're going to talk to the executive director of StarkMar, John Aller, and find out more about the agency and what they're doing across Stark County. It's a lot. Believe me, it is a lot as the Health Week continues right here on 1480 WHBC.
Thank you and your team for being constant companions and friends.
You have gotten me through many, many years.
News Talk 1480 WHBC.
Register to win your family reunion now at WHBC.com. The winner will be announced on June 25th. 1480 WHBC and That Little Italian Kitchen. We're all about family, friends, and food.
This is Jennifer Tassan from the Hackenberg Financial Group. Let's face it, experts agree that not planning for the costs of a chronic illness can be a staggering blow to your financial plan. Let me help you create a financial strategy to plan for a long-term care event and protect your assets. Call me at 330-489-9999. I'm Jennifer Tassan from the Hackenberg Financial Group, 330-489-9999.
When the game starts, the betting doesn't stop at BetRivers Sportsbook. Live betting is fast-paced and gives you a chance to pick up some value as the game unfolds. Whether you're looking to find plus money opportunities, hedge your bets, or invest more in your favorites, live betting at BetRivers delivers an exciting sports betting experience. Bet with a winner. Bet with BetRivers Sportsbook at BetRivers.com or download the BetRivers iOS app. Must be 21. Gambling problem? Call 1-800-GAMBLER. Playable only in states where BetRivers is licensed and in New Jersey at Play Sugar House.
And paid for by MPM, non-attorney spokesperson. Attention. This is an important message for anyone diagnosed with Parkinson's disease after being exposed to paraquat or other similar herbicides. Paraquat is a chemical commonly used by farmers and those that work with or apply herbicides. Residences near agricultural sites are also at risk for exposure. Scientific research showed that exposure to paraquat close to a residence increased Parkinson's disease risk by 75%. Numerous additional studies confirmed the link between paraquat and increased risk for Parkinson's. In fact, paraquat has been banned or limited for use in many other countries around the world. If you or a loved one was diagnosed with Parkinson's after being exposed to paraquat or other herbicides and suffered side effects, you may be entitled to significant cash compensation. Call us today at 800-951-6541.
Pounds and pounds of fur. Our hairballs have hairballs.
Our cat Mama, she's 10 years old. She has dandruff and an oily coat.
I have 2 cats, Sweet Pea and Daisy. Daisy sheds like crazy.
If you love your pets as much as I do, you'll want to do what's best for them to live long, healthy, happy lives.
DINOVITE.com. I just tried this wonderful Catalicious Dynavite for cats, and my cat has been on it for 2 weeks. She is not scratching anymore. She's not chewing anymore. It is just the best.
I was thrilled when I heard Dynavite for cats was coming out because I'd seen the changes in my dog. To introduce my cat to Dynavite, I took the advice from Dynavite and put their food on top of just a scoop in the bowl, just to get them used to it, because I know if I even switch one little thing, they put their nose up to it. There was not one problem.
Dynavite for life.
You won't believe how happy your cat will be.
DINOVITE.com.
Thank you and your team for being constant companions and friends.
You have gotten me through many, many years.
News Talk 1480 WHBC.
And welcome back to Health Week. We are here for our final segment on this Wednesday, and we are going to talk now with the Executive Director of MHAR, John Aller, Stark County Mental Health and Addiction Recovery. And so glad that we'll have a chance to check in with him, because you're the man who knows everything, John.
Good morning, Pam.
Good morning. So let's talk about MHAR. I mean, behavioral health. You guys have to be very, very busy these days.
Yeah, we really are. I mean, we're really trying to focus on kind of innovation through funding, collaboration, education, and advocacy. And so we really are trying to just kind of meet the needs of the community, especially during the recent pandemic with COVID and the existing issues around that.
So what do you see for the future? I mean, are things going to change for you at all? How are you going to progress forward?
Yeah, I mean, so really at this point, a lot of our strategies are based, as you've heard today, are really about how to get people able to access services quickly. And so one of the challenges right now that we continue to work on, along with everyone else in the community, is really kind of a stable, robust, qualified workforce. And so our funding cycle starts July 1st, and we've invested a lot through workforce development. And we're going to continue to make a large investment with that, because frankly, at this point, sometimes the dollars aren't the issue for people to be able to access services. We have money along with state and federal dollars to pay for services. It really is that qualified workforce. And so we're trying to work on some strategies around leadership development. We've been fortunate to partner with a development trainer for leaders from a large Fortune 500 company. And so really looking at the existing leaders that run not-for-profit organizations in the community, but also looking at kind of what we're calling emerging leaders. So almost building a bit of a stable of people that can kind of step into those positions and take over, because it is a complex field, with billing and just kind of some of the rules and some of the different levels of care for people to be able to access services, and really doing a lot of that kind of leadership development, and then doing some recruitment and retention for agencies that we fund. So things like maybe loan forgiveness for medical staff, maybe some pay incentives for people that are working in difficult to cover fields, or services that we need, like mobile response and detox. And so again, just trying to meet the needs of the community, and then using the agency and community voice to kind of direct us into what areas we ought to funnel additional dollars to support the system.
Has it been hard to move from pandemic mode to back to normal mode? I mean, what's that transition been like?
Well, so part of the challenge is that, Pam, nobody was really looking for anything to do. I mean, we are a system in general that runs pretty lean. And so, COVID threw in an additional wrench. And so we had weekly meetings with the agencies. We were able to obtain PPE and those types of items, protective equipment, those types of items for them. But it really does feel like we're moving out of that a bit. And frankly, looking at what needs of the community are different post-COVID. because I think there are some additional challenges right now to the community and to Stark County that we just need to make sure that we're able to address.
And do you feel like the county has done a good job of collaborating, putting the services all together?
I really do. I mean, I can tell you that with COVID, especially, we were on speed dial with the local health departments. A number of our agencies were in. We have 4 health departments in the county. A number of our agencies had services in each of those districts, and so they had to coordinate with all 4 of them. But I think overall, they've been tremendous to work with, and I do think in some ways COVID brought out the best in people, showing that collaborative nature and just the ability for people to kind of work together towards a common good. Phone
numbers. I know that there are quite a few.
Sure.
If you want to give those, so folks, get a pencil, pen, whatever, and have a minute to jot them down, because they're really important, and some people may not know where to go to find them.
Yeah, the three numbers that I think are really important is the first is the mobile response number or the crisis hotline number, which is the same. It's 330-452-6000. You did hear about the opiate hotline for people that are struggling with an addiction issue. That's 330-454-HELP. And then the last one, which is a little unique, but it's kind of geared towards some of our younger populations. But we also have what's called the crisis text line. And so if people would text for HOPE, which is 741-741, that's an opportunity 24/7 that people could kind of access services. It's a national company that we contract with, but then they'll be directed back to local resources if they need it. And so that's been a tremendous asset for us, especially, I have a 17-year-old son at home, especially for young people and people in their 20s. They seem much more comfortable texting than they do picking up the phone and calling.
Yeah, they react in a totally different way than we do. No doubt about it. No doubt about it. Well, the services are all there, so we certainly want everyone that needs to take advantage of them.
Absolutely.
All right. Well, thank you all. I have to say thank you to Dr. Anju Mader, also Michelle Allison-Smith, and Wendy Hunter, and of course you, John, for coming on with us today and filling this hour with some great information. We appreciate it, and we hope to do it again soon.
Thank you so much.
Thank you, Pam.
And again, we have Health Week continuing here on 1480 WHBC. Tomorrow, we will be in North Houston. Green Compassion Network Friday will wrap things up with Hear Inc. We hope that you'll be able to join us. A lot to get to and a lot more information to share. Again, you can go to our Facebook page to check out today's show. You can also go to our YouTube channel to do the same thing. And again, I hope all of you have a great day.